in real estate for 43 years, and again, known as Annie Gets It Done. And so this is, this group grew out of two things. One is meeting awesome people, and it's in New York. It's kind of an odd thing to say, like, do you want to go out? Do you want to be friends? And also just people don't have time. But then I put out this crazy taxi ad that instead of advertising real estate, I advertised looking for a man. And so it basically was, if you're fit and fat, if you've got a kind and generous soul and love your mother but still don't live with her, and can appreciate a fit and fabulous 56-year-old woman, feel free to give me a call. So what came out of that was not a date. I got a lot of phone calls from jail, which was great. I mean, you know, more power to him. One guy actually said, like, because I said, you know, if you love your mother, he's like, my mother loves me, I love my mother, and I'm like, the rape charge was not, I'm like, oh my God, I'm good. So anyway, so Jeffrey Dahmer probably liked his mother too. So, but anyway, but what came out of it is that women would come up to me, write to me, call me even, and say, that was just so brave. And what was brave about it? Yeah, I was looking for love, but what was most brave about it was that I actually dared to say I was 56. So that's the genesis of the Wise and Wonderful Women, because I had just moved into this building. No expiration date, right? So I just moved into this building. And I started to have meetings here. And prior to that, I would do some get-togethers, but religiously, even through the pandemic, I would hold meetings almost once a month. But every year, I would do something on heart health. And Dr. Suzanne Steinbaum had been introduced to me through a friend of mine, and she was life-changing to me because the stats that she taught me, the things that she explained to me about how women are gaslit and not taken seriously, played into my head every year since 2019. So when I couldn't breathe, and when I was gasping for air, and at an ER, and no one was taking me seriously, I heard her voice. And I was having a heart attack, and that's what kept me alive. So that's why we are here, because heart health and learning all about how you need to advocate for yourself is so important. But a few housekeeping issues. So, the bios. The reason why I do those bios is to show what a badass group of women we are. And reading through them night before, it is awesome. We've got energy healers, Alita St. James. She had 2 children at 57. I mean, twins. Crazy. But yeah, not one, two. But anyway, and I just love that. And I also asked where you live, not from a real estate, but I'm not trying to poach your apartment, but it's also so that you can go out or go home together. I think it also just lends itself to like, oh, you're on the Upper West Side, where do you live, So anyway, who lives on the Upper West Side? Okay, so look around, because we're going home tonight. Share a cab, go to the subway together, go home, ask each other out. Upper East Side. Okay. And notice how they're dressed. They're usually dressed a lot better. Anytime I'm showing an apartment on the Upper East Side, they're like, you must be going, you got pearls on. Like, because usually I'm a hot mess, and that's okay on the Upper West Side, sorry. But anyway, okay, who is downtown? And we're going to say anything below, I don't know, 23rd Street. Okay, well, hip and happening. Okay, good, okay. And Brooklyn. Okay, so you guys can go together, Queens. Okay, and if you're in Westchester, I can't help you. You're going to be taking your car, I'm sure, right? New Jersey's in the house, right? Oh, wait, there's New Jersey right behind you. There's Jersey, there you go. All right, anyway. Oh, there's Jersey in the back. Okay, oh, sorry, Midtown. Sorry. Oh, sorry, Midtown. Okay, well, good. We can go home together. Okay. All right, so what is on your tables? Okay, I want you to pick up, there's 2 cards. I want you to pick them up. Hold them in your hands. The first one is going to tell you about Save the Date. So this wonderful functional medicine doctor who I have taken a life-changing boost your immune system workshop with up at Kripalu a couple times is going to be here talking about breast health. and she's a breast cancer survivor. Early on, she got breast cancer. She's a great doctor. She's got a podcast and a book, so she will be here. You can make a reservation now through Caitlin's new QR code and Google Drive. Then there is also the Go Red for Women campaign, and we will explain to you the importance of Go Red, which is part of the American Heart Association. If there's anyone in here that doesn't feel a call to action after this talk, that's okay. But I think many of you will, because we need to be women warriors, because we are not being researched enough. And guess what? Men and women are different. I don't know if you've noticed, but men and women are different. But as far as the medical field goes, we're not actually. We are men. And we have no hormones. Anyway, I know I have no hormones left, but that's another story. But anyway, so the Go Red, the Circle of Red, is women that will commit to $5,000 or more, getting your business involved, you personally making the commitment to join other women to advocate for heart health and research. And when we say heart, we're talking about your brain too. We're talking about aneurysms and strokes, and we'll tell you the stats there in a second. And instead of having flowers today, I actually put those stats in front of you because they are really pretty enlightening. Let's just say that. The other thing is we just started a wonderful Wise and Wonderful Women YouTube channel, and it is featuring. Many of you have been. Alita was interviewed. Annie was interviewed. And we're sharing women's stories that are just real stories, real women. And I really encourage you, subscribe. It's not going to cost you anything. It just shows that people are watching and looking at them. And if you'd like to be interviewed, reach out to me. And then there's also the Instagram and all of the other stuff that's on there. What else is on that card? Is there anything else? Let's see. I think that's it. Okay, and the one other thing is the invitation on February 24th. So if anyone is interested in getting more information about the Circle of Red, obviously a tax-deductible donation, the 24th is when we are having a get-together with some terrific speakers, including the wonderful Dr. Suzanne Steinbaum. Maybe, well, actually, yes, you are, right? You're there on the 24th? Yes, okay, perfect. Okay, great. Okay, and one last thing, there we go, okay. Who's new? Okay. So that's what I love about these meetings, because people that are new kind of float in and out. So we don't ever have them on Wednesday night. We have them at different times of the month and on different days so that people can come. And it doesn't matter if there are different topics that you're not into. But there is a library on the Wise and Wonderful Women's website that will have all of these meetings that are being recorded, and it's important information, so go back and watch it. There's things, everything ranging from sex toys to vaginal health to financial health to raising a financial grown-up with kids. So anyway, it's really important and cool stuff about insurance. So I encourage you to go to the website and watch them, because tonight will be recorded. So if there's anybody that you think might benefit from seeing this, I want you to make sure you share it. And one last thing, there are Annie Gets It Done pens on there, yes, because I'm a marketing crazy person, but I want you to use them. There's pads there. Inevitably, we always have too many pads, so if you need to, if everybody wants to write things down, do it on the pads and not on your phone, because it's distracting as speakers that we think you're bored and you're texting. So write down, you're going to get information, but know that we will, A, it'll be recorded, and then B, we're going to send a thank you email for coming, and we'll try to send all those resources on there. Okay, so I'm just going to call up our two speakers, and then I'm going to ask you to do one thing for me. So Dr. Suzanne Steinbaum is a leader in preventive cardiology, as well as the founder and CEO of Heart Tech Health. She's also a near and dear friend to my heart, as she is the cardiologist that saved my life. And the fact that okay, and another friend of mine is Meg Gilmartin. She's the Regional Senior Vice President and Senior Executive Director of the American Heart Association, who oversees all fundraising, community health initiatives, and volunteer leadership. There we go. All right, so we're going to have to share this. And so hold on here. Okay.
Meg and I know each other. She
Very
goes
well.
on the talker.
Here we go. All right, so just make sure that when you are going down here, nope, all the way up, all the way up, there you go, okay. So I'm gonna ask these two tables to do something for me. So Annie, I'm gonna ask each of you to count 1, 2, 3. 1, 2, 3. 1, okay? So let's go.
1, 2, 3.
1, 2,
3. 1, 2,
3.
2, 3. 1, 2. 1.
No, 3.
3.
We're just gonna say 3. Okay, so we're gonna end there. So every number 3, stand up. Okay? So out of this group, 1 out of 3 women is going to die of vascular disease, cardiovascular disease. Stroke, aneurysm, heart disease, heart attack. So that's pretty crazy. That's more than any of the cancers combined. 1 out of 33 women dies of breast cancer, but we're all running around and getting our mammograms. So this is serious shit. Sit down, thank you. So I want to just also, having been involved with the Heart Association and having shared my heart attack story only fairly recently, which happened in May of 2024, I've been hearing crazy stuff. And Suzanne and Meg hear these stories all day. But I want to share stories about 3 people, very briefly, that are in this room. So Nora, in her mid-60s, has high cholesterol and a history of heart arrhythmia. She was having trouble breathing and was exhausted. But after going to urgent care and doing a Zoom call with her doctor, she was told that he would see her next week. She coded 2 days later. Natalie, also in her mid-60s, after hearing a coworker discuss the results of her calcium score, she brought up having the same test with her cardiologist. He told this former smoker with high cholesterol, "I don't believe in those tests. You don't need it." So she pushed. "Well, you're gonna have to pay for it out of pocket. It's $1,800. But she took it anyway. And guess what? She's now the proud owner of 3 stents and is alive today because she advocated for herself. Annie, 24, one of my fellow Heart Association survivors, was exercising and suddenly could not feel the entire right side of her body. Her face was drooping, she couldn't walk properly, and she was told by the hospital she was having a migraine. But one doctor listened and looked at her and ordered an MRI. She had had a serious stroke. So, and with my own situation, I was told that I needed to breathe into a paper bag, that I was having a panic attack, I was gasping for air, I could not even sit up. I was told, "You do yoga, breathe like you're doing yoga." And so anyway, 8 hours later, my heart had torn and I had a stent because I was having a heart attack. And the person that actually was on the phone, because I was in the Netherlands by myself, was this woman right here, listening to the madness and begging them to take me seriously, and they basically hung up on her. So this is kind of personal. So I want to first talk about the stats of, obviously, women are dropping dead of a variety of different things having to do with heart and vascular health. But share a couple of stats, but then I really want to start with prevention, because then we're going to go and do the deep dive down.
I know you told me not to do this.
Please don't, because we have very little time, and you are such a wealth of knowledge. But talk close to the back, because they can't hear in the back.
The importance of this conversation cannot go underestimated. And I think what Anne is describing is worse than you could ever imagine. And so what I'm going to tell you, I want you to write it down. I want you to pay attention. I want you to pretend that it's you that it's happening to, because if we don't identify with ourselves as being a possible heart disease patient, then we don't take it seriously. So as much as you exercise, as much as you diet, as much as you pay attention, as much as you might not have a family history, if you have a heart, you're at risk for heart disease. 1 in 3 women will die of cardiovascular disease, more than all cancers combined. When a woman enters the emergency room, 66% of the time, the testing that is done does not diagnose the problem. She is 7 times more likely dismissed and discharged from the hospital without treatment or care.
Than a man.
This is all compared to the man. She is 30% when she enters the emergency room with symptoms, more likely to have a 30% delay in treatment. I can go on and on and on. If you don't understand this and you don't advocate for yourself, then it is a big, big problem, because a study showed that when a woman has heart symptoms, 59% of the time she experiences gaslighting. What that means is exactly what Anne is describing. I was on the phone with the doctor saying, I am her cardiologist, she is at risk, take her to the cath lab. And they said, what are you doing on the phone? They were nasty to her, they were horrible to her. It was one of the worst situations I had, and this wasn't one call. How many times was I on the
The
phone?
second call, a female cardiologist, after
she
they
was
had
the
released me
worst.
with not putting the proper medication, and I was back in the hospital again because they didn't give me a beta blocker, which is the most important medication that you can get when you've had a heart attack because it levels your heart. She actually came down, put the test results to the side and said, are you okay? And
I was on speaker and she didn't know it.
realize.
So
Are you
this is
okay?
not, we're not talking about bashing male doctors. What we're talking about is you actually empowering yourselves and becoming your own best self advocate. And that means you have to understand that you're at risk. There was one study, it was years ago, you might know the year. It was a group of women,
Do you know the year?
2,000 women, a survey was done. 2,000 women, a survey was done. And fairly educated group of women. And out of those women, it was a lot, it was like 97% said, yes, heart disease is the #1 killer of all women. And then the question was asked, what is your personal risk of heart disease? And guess what? 13% said it was their problem. It was everyone else's problem in the room, but not their own. If I'm gonna tell you there's one thing to do today when you leave here, is acknowledge the fact that it actually could be your problem. And then we'll talk about what you do after that. But if you don't think it's your problem, all of this is just entertainment, right?
Bam. All right, so let's talk about what it
Did I
is.
answer your question?
Yeah, you did.
Okay.
You did. Okay, so I'm gonna kind of do it a little bit backwards. When you walk into, and we'll talk about kind of let's just talk about the research, because I think that that's really important. Can you share, because one would think that when research is being done, that you would, because women are 50% of the population, that when you're doing like research on heart, that doctors would have called in men and women to test hearts, right? So what happened? What did we realize about heart and
Cardio research.
That women and men are uniquely different, and that women are underrepresented both as patients and as clinicians and researchers, correct?
Yes.
And that we are not being studied or treated in ways that are unique and appropriate to who we are. You know, I wanted to just double back on one thing. The situation that happened in the Netherlands, that is not unique to the Netherlands. That exists here in New York City, it exists in Miami, it exists in, Kansas City, it exists everywhere. And the one thing I just wanna say, and this is going a little bit off track, but what I wanna say, I think one of the reasons why 13% is because we also don't want to admit to ourselves that we may in fact not only be at risk but be susceptible, because we're always pushing off things going, oh no, I'm okay, I'm invincible, I can deal with that, because we're caretakers for everybody else around us, and what we're not doing is looking at the importance of caretaking for ourselves.
Here.
So I went off track there, but that's critical.
Well, yeah, because we were talking about this earlier,
And we were saying, and I can tell personally, I came from a family that you don't take medication, only if you're like a loser or something, I don't know. So when I went to Suzanne, because I had a heart attack, but I was being seen by a great cardiologist, because I didn't listen, right? Because I thought that if I exercised enough, if I ate whatever it was any given time, I felt shame that I could not get my cholesterol down. And we would keep going, and it kept going up, and I was like, yes, but. And I really felt this shame. It's that screwed up, but I did, and it nearly killed me.
It's not Anne, it's the story. And part of the story is that when you hear of someone when you hear of someone diagnosed with breast cancer, she's a victim. When someone gets heart disease, there's a lot of shame and guilt around it, and nobody wants to talk about it. And so it's been this like behind the scenes story that women don't want to come forward. I remember back in the day when we really first started Go Red, or in the early days, we could get one celebrity it's still hard to come out and talk about it, because it meant they were weak, they were fragile, they didn't do enough exercise, they didn't diet enough,
They were sneaking cookies in the corner.
they didn't want to talk about it. And so this is not about that. You know, I say if we all live in bubble wrap on the top of Kilimanjaro and someone is cooking for us, maybe we'll be fine. But we don't. We live with the genes we have. We live in a crazy world. We are sometimes not sleeping. Every little decision and choice has an impact on us. Stress, not sleeping. This is inflammation in the making. This is how arterial disease begins. And so it's life. And how life impacts us is a little bit unpredictable. And sometimes it impacts our hearts. And that's what makes us all vulnerable. And it's not because we didn't do the right thing, and it's not because we ate a cookie in the morning. I had a patient today, she's like, I had a brownie. I'm like, was it good?
So
Not gonna kill you.
where I was going to start with prevention, but now I'm going to go back to the advocating, because one of the things that we've talked about is that when women walk into the ER,
Yeah.
they're not taken seriously. But the other thing that we do is we delay going, okay, because we don't want to bother anybody,
Right.
And then you make excuses.
Then you're apologetic when you get there.
Right, exactly.
I don't really think I'm having a heart attack. I don't want to take your time. You become very apologetic. Like, we are really powerful women. Why are we afraid to say, you know what, there might be a problem, and wouldn't it be fucking awesome if there isn't actually a problem, but I showed up to make sure there wasn't, right? Right?
So there's a friend of mine that actually was supposed to be here tonight, and I just want to, through you showing up every year, which saved me because I kept hearing your voice when they weren't taking me seriously and the EMT guys were going to leave me there and I was going to die, I just kept hearing your voice. I know something's wrong, I know my body, and I need to keep advocating. But I got a phone call today from somebody that was not going to be here tonight because she said, I'm listening to you. I lost eyesight, I lost sight in my right eye yesterday, and then I had a really bad headache. I'm feeling better now, but I'm listening to you and I'm going to go to the ER. And so I just felt so glad because she said I would have never done it if I didn't hear your voice. So what we did say was when you get there, because she said, I'm feeling better. I said, that's not what you're going to say when you're going into the ER. I'm really sorry, right? So I said, no, you're going to go in there, make sure that you bring your charger and your pillow and a few snacks or whatever. Okay, gave her a whole list of things. I said, you go in there and you say, I lost my eyesight. I can't, I go through your list and say, I think I'm having a stroke. And that's it. Be clear. And they took her right away. And they will take you right away. They are in the ER. They have a job to do. They're waiting for you.
We did shifts. You're on for shifts. We're going to be there whether you show up or not. And in fact, when you don't show up, like, we're bored. We want to work. We're there. Come. It doesn't matter. If you're fine, you're fine. But you gotta show up. Do not wear makeup. Do not wear makeup.
Look bad.
Look as bad as you can.
Seriously.
I am not kidding. Women are like more dismissed because they look too good. Take it all off. Number one. Number two, no excuses. Just state the facts. Just like she told her friend. And you might want to add, can you please write my chief complaint in the note? I think I'm having a heart attack. Because if something happens to me, they'll know what I said, and my lawyer will really want that information.
No, you need to. I mean, you don't, you really need to be clear. And you know what was so great? There's actually a woman doctor, I took down her name. It was about a couple months after I had had the heart attack, and I was feeling on my left side, under my heart, like pain. And I was pretty sure it was gas, but I had promised my kids that I was gonna take it seriously. And it's like, okay, it's 2 o'clock in the morning, I'm going to Cornell. And I walked in and I was feeling like stupid, like, I've had a heart attack, now I'm going there and there's probably nothing wrong and it's probably gas. And this doctor was so wonderful, and she said, it's good that you're checking this out. That's why we're here, okay? So if there's one thing that you're going to be left with today, is go to the ER. Go to the ER. You're not gonna go to urgent care, you're not gonna go to your doctor, because they can't do the proper tests. And when you walk into the ER, one of the really important things to do, which they didn't do on me immediately, which they should have done, is an easy blood test, which is
The
troponin.
troponin. Yeah.
Okay, so can you just explain that?
So troponin is a
And a D-dimer or no? The two? No.
No, you
No.
would.
Okay. No.
Troponin is a blood test. It's a very sensitive marker of muscle damage. And so that is a very simple, easy test to get.
So simple.
And troponin, Troponin.
It's just a simple blood test. It takes a little bit of time to get through, but it will see if you're having a heart attack. And that's, as I was sitting on, in the room with nobody paying attention to me, they had full blood, but 2 or 3 hours later, they finally looked at it. And I had been texting with Suzanne, and all of a sudden, I said to the guy, aren't my blood tests back yet? Please, can you just look in the computer? And he looked at the computer in the room, and I saw his face, and he ran out. And there was somebody sitting with me, and I said, take my phone, take a picture of it. I took a picture of the screen, and I sent it to you, and I started looking at it, Googling, and she's like, you're having a heart attack. It's like, what? So anyway, simple test. Make sure they take your bloods right away, because it takes a little bit of time to get back. Okay, so let's go back. When you go into the doctor, okay, what are you need to know your risk factors, and I want to talk about what you should ask to have done, and then what kind of tests.
The algorithm of how your doctor thinks is really first by risk stratifying. Are you at risk for heart disease? So a 25-year-old woman who has no health issues is at pretty low risk. If you put on that same woman that she had preeclampsia, gestational diabetes, any adverse outcomes of pregnancy, family history, all of those issues increase her risk of heart disease. And as we think about what the risk factors are, there are the traditional ones. There's high blood pressure and high cholesterol and elevated sugars. There's the poor diet, lack of exercise, obesity, smoking, lack of sleep. I just called out what
Life Essential 8.
Yes.
Thank you very much.
I wanted a taxi.
8, we just added sleep. It used to be the 7, but it's now 8.
Essential, well, no, it was the simple 7, and now it's
Life
essential
Essential
8. The one, it's gonna be 9 soon, and what's gonna be added, I think, is stress, but it's hard to measure stress.
Yes.
But what we understand is that some of these things are under our control, and that's diet and exercise and sleep and smoking and actually our weight a little bit, right? And those actually impact those other risk factors. But what we know for women and what's not part of standard risk analysis, any of the risk analyses, are the other things. These adverse outcomes of pregnancy, any problems during pregnancy, autoimmune diseases, which more often happen in women, things like rheumatoid arthritis, ulcerative colitis, things like that, also increase the risk. But things that you might not think about, like depression, increases the risk of heart disease 2 to 3-fold. PTSD increases the risk 11-fold. Our minds and our hearts are truly connected. And so if you understand your own personal risk, and going through this, think about this. Job insecurity. There was a study with the nurses' health study that showed women who go to work who are under exorbitant amount of pressure have a 30% increase in cardiovascular risk. Again, this mind and heart connection. So when you go through all your risk factors, it's not just the cholesterol, it's not just the blood pressure, it's not just the sugar. That's the first thing that you need to understand, and certainly talk to your family, because family history plays a huge role in this, okay? The next thing.
So when you're going to the doctor, all of these things should be brought up, because it is just not about the blood tests,
Right,
right?
right.
I mean, this is just not a little simple kind of thing.
And if a risk analysis is done on you, and we do have standard risk analyses, most use either the Framingham or the ASCVD risk analysis, which every doctor has in their electronic medical record. It actually misses your risk 50% of the time, especially if you're below the age of 65. Okay?
Because that's the standard protocol now versus
So these risk analyses are standard of care. I mean, this is what we're all using. This is what you're taught to use. This is part of the EMR. You actually have to do it.
which is why
Which is part of the problem, because you're going to be told you're low risk, but no one's asking you the right questions. So you've got to offer the information. And I'm telling you what to offer, because if these are part of your life and you had a problem with pregnancy, it's probably not part of your electronic medical record. How many doctors ago was that, right? So you have to bring this information forward. What happened? And it's what happened not in that day, that year, but it's over your entire life, okay?
And if you're not being listened to your doctor, when you do bring it up,
Get another one.
get another one. Bye-bye. Okay, so in terms of, so when you're going in, and let's say you do have if you do have an elevated risk of cardiovascular disease, okay? What are some, because I just want to touch on certain points, because we could be here for a long time. There's a life-changing test.
So we're gonna first do blood tests, right?
Okay.
And those blood tests.
In a bullet point. Boom, boom, boom. Go ahead.
It's not my strength. No. Bullet point. We're going to do a lipid panel, cholesterol. Everyone's heard of cholesterol, HDL, LDL, triglycerides, but there's other things. Apolipoprotein B is a more sensitive marker of what part of that cholesterol is going to lead to plaque. LDL isn't enough. It's just not giving enough information, and that apolipoprotein B can really tell you a better picture of your risk based on your cholesterol numbers. Hemoglobin A1C is a marker of how your sugars have been. Are they elevated over a 3-month period? It can give you an understanding if you have pre-diabetes or metabolic syndrome, or even if you have diabetes, which is a significant increased risk, especially in women compared to men. Then you're going to get something called Lp(a), which I get very upset. The American Heart Association calls it a novel risk factor. I started studying it about 30 years ago. But it's the point that research takes about 20 years for it to hit clinical practice.
Can I just stop you right there? Hold on 1 second. About the research. Prior to what year were only men being tested for heart disease? Not tested, research. Research was
the
only
Heart
done.
Association and you know more from the clinical side, but as a heart association, we've only brought forth Go Red for Women, we're in year 24. So that is not very long. And the Heart Association celebrated our centennial. We're 102 years old. So dynamically, the first 80 years of our organization, which, by the way, historically says was founded by 5 white men, doctors in Chicago, and actually was an incredible nurse here in Bellevue who actually determined that the re-entry rate of cardiovascular patients was way too high and they needed to have better treatment. She was the one who first recognized the need. So I want to give full credit about the fact that the Heart Association actually was begun by a woman. But it's really only been in the last 24 years that it has come to life, and that we were really investing. And even still, you know, the number of women who go through med school, who actually complete studies and go into practice decreases and decreases and decreases to the percentage being very low right now, correct? Compared to men.
Cardiologists.
Cardiologists.
So when I started, it was 11%. At one point it went as high as 18%, and now it's back down to 12%. It's the only place, the American College of Cardiology huge conference, it's the only place where there's no line for the ladies' room. Ever.
Right, ever, right?
And
Ever.
if you're having a heart attack and you're treated by a female doctor, your chances of survival are much higher. Is that correct?
Isn't that interesting?
Isn't that interesting? Yes. But the research was only done on men
Until
Up until-
1993.
Until
1993.
So in 1993, the Office of
1993.
Women's Health.
only on men. Is that insane? It's insane. So we're a little bit behind. So when we're talking about that we don't have enough data, the data is now
We're just catching up.
coming about, just catching up.
Again, it takes 15, this is hard to understand. It takes 15 to 20 years for that clinical research to hit your doctor's office. It takes another 5 to 10 years for that to become standard of care. And the American Heart Association, cardiologists look towards the American Heart Association for these algorithms, and they start with a scientific statement. Like, guess what, you guys? It's like a billboard. And then it takes about 5 more years. So this Lp(a), I think, is a great example of that, because that research did start about 30 years ago. But it was questioned, like, what is it and what is it doing? And then they have to look at it and analyze it. And clinical research is tedious. It's hard. And we look at outcomes. We wait to see who's going to have a heart attack and who's going to have a stroke based on whatever intervention we do. And that might not be in the first year, and it might not be in the 5th year. It might be in the 10th year. But does that make it irrelevant? Doesn't to me, right? And so this is a complicated science, and it's a little bit of a complicated art, because it's not the cardiologist that's going to treat you algorithmically right now is not going to take great care of you. And you have to find a doctor who's reading, who's looking at studies, who's understanding women's hearts. The reason that women cardiologists tend to be better doctors for women, not only do they listen differently, but they're interested. And if you get a doctor who's not interested, I don't care if it's man or woman, just leave. They're never going to help you.
Right. One of the things that was interesting, because I want to go back to testing, because who's heard of a calcium score? Okay, so I had a calcium score before I had my heart attack, and that was one of the reasons why I refused Suzanne's recommendation that I was on a statin, because I said, well, wait a second, again, I'm beating myself up, right? I'm supposed to be exercising more and meditating more and doing all these things more because I'm less than, right? And the statins made me really achy, more so than most, but I was like, okay, I either take a statin or let me see if there's any damage. So I took the calcium score. My calcium score read 0. I had no plaque. So I said, I'm not taking that statin. I'm not taking it. And I had a heart attack.
Please
So
don't
there's
get a calcium score, it's a waste of money and time.
What?
What?
Yeah.
Wait a minute.
Please don't get a calcium score.
Right.
It's a
Why
waste.
not?
There's a
I'm
new
gonna
test.
tell
Hold
you.
on.
I'm gonna
Listen.
tell you, and this is really
Life
important.
changing.
And this is don't get upset, because I'm gonna explain. I'm gonna explain. Again, it takes research, clinical practice, and then things start shifting. Calcium scores do not develop in women till about 10 years later than they do in men. Plaque begins soft. It's non-calcified plaque. It's the beginning stages of disease. It actually starts with the lining of the artery getting stiff. It then develops that the small microvasculature gets stiff. And then soft plaque develops. That soft plaque does not become calcified for a period of time, and everyone's a little different. So a calcium score of 0 gives you a very false sense of security. The algorithm right now tells OBGYNs, I'm going to call them gynecologists because when they're prescribing hormone replacement, you're probably not having babies necessarily. But those gynecologists who are supposedly menopause specialists are told, get a calcium score on your patient before you prescribe hormone replacement therapy. Doesn't make any sense.
So there's a new test, and it's called the Clearly.
So when,
The Clearly.
let's go through algorithms again. When you have chest discomfort, there's testing that can be done, things like stress testing. The other test that has been considered, depending on your risk and how you present, is a CAT scan angiogram. There is a CAT scan angiogram. Now this is a CAT scan of your heart where you get injected with dye, just like through a regular IV, and that dye fills the arteries in your heart and takes a picture, and you can see if there's plaque in the arteries. Clearly, CLEERLY is an AI-generated picture that's superimposed upon this CAT scan angiogram, and it actually looks for non-calcified plaque. It quantifies it. They did a study, it's called the CONFIRM-2 trial. Everyone's into ChatGPT, which is why I'm giving you this, because you can plug it all in with yourself and it can tell you information. But this trial showed that it could quantify the amount of non-calcified plaque, and that in itself gives a greater estimation of cardiovascular risk for women compared to men.
Right, so my Clearly, I think off the top of my head, showed that I had 25% of soft plaque in my heart. Very different than 0, okay? And soft plaque is less stable and more dangerous.
Most heart attacks happen from soft plaque, 30 to 50%. Why are we checking calcium scores to decide if a patient should be on a statin? Now, if a patient has a lot of calcium, it means they probably have a lot of soft plaque, because soft plaque matures to calcium. So it's not that it's totally wrong. It's for the patient that has a 0 score, you don't have enough information, or the patient has 0 to 100, you don't have enough information. Over 100, we start understanding that risk. But that patient that is just okay really might not be okay. And so that's what this test really does tell you.
One of the things that I learned through you was there are many people that take statins. Has anybody taken a statin and gotten the burning arms, or like, I mean, I had some really, everything, right?
Hair falls out.
Right, so there's some side effects that people have, they're statin intolerant. And so I was put on some drugs that, there's a thing that's Repatha, which is just lowers my cholesterol, really. But what you taught me and what we then worked together, and this is why it's not just a one-stop shop, because that statin.
There's not just statins, and there's many different kinds of statins.
Right, and that's what we had to figure out. What works for me?
You don't have to take it every day, and some are longer acting, and you could take it every other day, and some of them have less side effects, and then there are other medications that are not statins that block absorption of cholesterol in the gut, and then there are other ones that are new on the market that actually decrease the risk of cardiovascular disease by 30%, and they're not statins. But I will tell you one thing about statins and why they're amazing if you could take them, is that they decrease inflammation and they calcify plaque.
They harden the plaque.
So when your calcium score goes up, it's a little counterintuitive, it's not bad, because it means that the soft plaque that was vulnerable to rupture and cause heart attacks is now calcified and stable. So statins are a little magical. We don't 100% know why it works that way, which I think is interesting. Mm-hmm. And it just decreases the inflammation and actually stabilizes the plaque.
Okay, so we only have about 8 minutes left here. So let's go back to prevention. We talked about sleep. So let's just touch upon So stress, one of the things we talked about,
Did you
right?
read the article that just came out like 2 days ago when they were talking about longevity and the individuals who are living to be 100 plus? And it was I literally just read it the day before yesterday. The number one thing that they identified was that there was almost no stress in their life. So all those other factors that we talked about. So the question is, who can live with no stress?
In New York City.
Correct.
This was,
Right?
okay, so that's
TM.
nuts,
Because
because,
who can live with no stress?
Well,
We all don't
right.
live in,
But it's important, and this is what got me into trouble, because I was like, well, that's off the table. That's something that there's no way, as
Yeah.
being a single working mom in New York City, you know, with
Yeah.
people like walking up and peeing on my feet on the subway, right? You know, like there's no way that I can have no stress.
everyone needs a.
Transcendental meditation, if you didn't see Bob Roth speak in January, look up the library. Meditation is now being actually cardiologists, even a male cardiologist that I know actually said meditation was good.
It's interesting.
How you
Actually,
handle your stress.
It was
How
the
you-
Journal of the American College of Cardiology did, American Heart Association, we'll get there in a second, but the Journal of the American College of Cardiology did a research protocol on transcendental meditation, to the point that they wrote the protocol exactly how it needed to be done. I thought it was fascinating. Like, how do you write down how to meditate? But they did. They seemed to be able to standardize the procedure. And in standardizing that procedure, they then were able to study it. And they studied it looking at arterial dilatation. There was a whole list of variables, but in this one study, it was about arteries dilating. If arteries dilate really well, they're healthy. It means they're not stiff. And if arteries are not stiff, then they can't develop plaque. So that arterial dilatation is really important. There was a 30% improvement in arterial dilatation with patients who use transcendental meditation. I had been talking about it since 2008, I think. We had a little financial problem going on, and everyone was coming into my office with chest pain and palpitations, and I kept running out of monitors, and I was like, what's going on? I know more about the stock market than anyone else does because everyone gets sick. And it was really that time period of understanding patients need something else besides Valium, and I'm not going to prescribe it. And it really came down to, what are the tools? Everyone needs a tool. I literally almost passed out on the floor when the American Heart Association came out with a scientific statement about meditation and the use of meditation and stress modalities for the treatment of cardiovascular disease. I felt like angels were singing. It was like, oh, what happened?
Right, because the
Because
research is behind.
Because the research finally hit practice. And that's what I'm trying to say. It finally got there enough that a clinical statement was made. So a male cardiologist is going to say, yes, transcendental meditation works. You need to figure out a tool. I don't care what it is. It's not TM, it doesn't matter. You got to figure out something. It's yoga, it's breathing, even gratitude. I'm telling you, even laughing your butt off helps. It helps dilate the arteries. You just gotta find a
What were you
thing.
gonna say?
You know, I wanted to say something on that too, laughing. Laughing is it truly is a positive medicine. You know, we've talked a lot about the clinical side, the research, and by the way, everything that the Heart Association does is all backed in science. I think what's critical in the stats that we're talking about is that when we're talking about that 1 in 3, up to 80% of these cardiovascular risks and deaths can be prevented. And I think that's what we also need to be thinking about. So when all of you stood up, that so-called death sentence of 1 in 3 of us is not necessary to exist if we look at thinking about what we can control, what we're talking about, the life essential aids, what Suzanne was mentioning as far as those things. Those are all controllable factors. Genetics is not something we can control. I happen to be adopted. I have no idea what my genetics is, and my doctors all my life have said, Meg, it doesn't matter. Live as if you are healthy and you don't have that. And I sit here about to turn 66, knock on wood, and have had no comorbidities in my life, no major health issues. And I'm, in the end, obviously lucky with genetics, but lived a lifestyle of being conscious and aware of what I'm doing and how I'm managing what I take into my body. And our comments about stress are critical. Stress exists in our lives, no doubt. We have to find the tools and resources that work for us to manage, and it all looks uniquely different. Just as when Dr. Steinbaum treats a patient, the pathway looks different for each patient. Your journey in your own health to manage your health also looks uniquely different. Mine doesn't look like yours, mine doesn't look like yours, but you need to be empowered to find the resources available and the tools that can help you on that, so that in fact, you can be one of the 80% prevented.
Exactly.
Prevention?
So there's, I want to just meditation, prevention, okay, food.
Let's just run through this really quickly.
Yeah.
Because in that 80% of the time that's preventable, it is critically important that you understand that means about your life decisions every single solitary day. And it means keeping track. So you can do all the things and you still gotta get checked.
Yep.
And when you get checked, you gotta get intervention. And so what are those things you're gonna do every day? You're going to, number one, eat healthy. That is not the latest fad. I'm absolutely crying on Instagram right now and just looking at people talking about high protein. It is critically important that we have high protein. Saturated fats in excess are not good for you. That should not be your source of protein. Mediterranean diet forever has been shown over and over again to be the best diet. Just think about being on the islands of Greece, Italy. We were talking about that back there. That's what you need to eat. Omega-3s, complex carbohydrates. Guess what? Carbohydrates are not so bad for you. Just don't eat crap, you know? It's really the complex carbohydrates. It's fish, it's olive oil, avocado, multigrains, fruit. And I said to Anne, don't eat the fruit that grows in the sunshine. It's too sweet. Eat the fruit that grows in New Jersey.
I was like, nothing grows in New Jersey. Nothing grows in New Jersey. Sorry.
Okay.
Sorry, Jersey's in the house. Sorry.
I grew up in New Jersey. I can say that. So,
Apples, pears, and blueberries.
apples, pears, blueberries, everything that I got at the farms, right? So that's the diet. Exercise. I'm quoting everything that is coming from AHA. 30 minutes, 5 days a week, moderate intensity exercise. What that means, back in the day when we used to exercise till we felt like vomiting, that's not how we do it anymore.
It's not good for your heart.
Walk 30 minutes. Walk the streets of New York for 30 minutes straight. 30 minutes straight.
Get your heart rate up to a point if you
Apple
have
Watch.
I love monitoring, I'm like monitored up, but if you don't want that, then it's bring a friend. If you can have a conversation, but it's a little hard, that's your moderate intensity zone. 2 days a week of strength training, major muscle groups, quadriceps, glutes, hamstrings, biceps, triceps, all of those things, you are going to actually prevent heart disease, decrease blood pressure, prevent osteoporosis. It's going to give you happy hormones. By far, exercise is the best medication. Okay, stress management, diet, exercise. Next, we are going to talk about sleep. I don't think that it's my favorite topic because I feel like a hypocrite. So let me tell you what not to do. Put your phone outside of your bedroom. No television in your bedroom.
Yes.
I'm going to start with, again, put your phone outside your bedroom. When you have those interesting thoughts in your head at 2 or 3 a.m., like I do, write it down. Keep a lot of notebooks and pen, but put your phone outside your bedroom. You're going to put yourself to bed the same way you would put a child to bed. You're going to start an hour to 30 minutes early. You're going to have a routine and a regimen, whether that's hot tea, low-fat milk. You're going to do that.
Not caffeine.
Bath, nothing that is going to stimulate, right? And you start just winding down. You can't say to yourself, I'm going to bed at 11 and start washing your face at 11:01. It's just not going to happen. You've got to give yourself that downtime to do it, okay? I think it's also very important to know yourself. If you say, I'm going to get up, and this happens all the time, I'm going to get up every morning and go to that 8 a.m. yoga class. Monday you get up at 8 a.m., you get that yoga class. Wednesday you're there, Friday it's done, and you're a failure. Don't do it. Do things that make sense, that you can do, that's part of your life, that you're capable of doing, that you enjoy, that you want to show up. It takes 6 weeks to make a habit. If you don't like it week 1, hang in there for week 2, week 3, start cursing, wait till 6 weeks and you're gonna wanna do it. Just find out what it is and fit it into your life so it doesn't become a burden. Same thing comes for diet. Don't not have food with you, don't be hungry and just end up somewhere so you grab the french fries because that's all that was there. Pack stuff, cut up apples. I mean, think about yourself a little bit like you would your child. And this is the last thing, and this is what we were talking about. If we actually connected to our hearts in a very, very different way and understand one last thing. In 1994, a study was done, autopsy on the heart. When they looked at the heart cells, there were brain cells, the same cells in your brain, what generates your thoughts on your heart, which means your heart is feeling every decision you make. If you connect to that part of your heart, take care of it in a very, very different way. You're gonna feed it differently, you're gonna go to bed, you're going to not stress as much because it's feeling every decision you make. And with 80% of the time, heart disease being preventable, I always say just live from the heart and you're gonna be fine. Just know it hears you.
Okay, would you do me a favor? Can you tell me, because the symptoms, we just gotta bang out 2 more things. Symptoms for women having a heart attack or a stroke are often different than elephant sitting on your chest,
Very
left
different.
arm is like, so can you tell me
Well, I
women?
think we should have the doctor speak to the
Okay,
symptoms, definitely.
Quick, bang them out.
Hollywood heart attack, elephant sitting on the chest, blue in the face, sweating, radiating down the left arm, classic. Women, jaw pain, short, it's also chest pain. When I ask women if they have pain, they never say yes. It's either pressure or discomfort, that's what I hear from all women. Shortness of breath, jaw pain, back pain, nausea, vomiting, flu-like symptoms 2 weeks before, even some sleeplessness, fatigue, and just not feeling great. Every single one of us in this room at some point has felt every single one of these symptoms. How do you know? That's partially why exercise is so great. You can't do what you've been doing. Your normal activities are really harder than usual. You got to think about your heart. That's one of the best things.
Right. One of the things that when my friend was having distress, she was texting me and she was saying, I can't breathe. I'm having trouble breathing. And I was thinking, the doctor thinks that I might have COVID. I'm thinking she's congested. And then something just rang in my brain and I was like, let me call her. And I spoke to her. I heard immediately she was not congested. And I was like, well, what do you mean? And she said, why do you think you have the flu? Because I'm tired. Do you have a fever? No. You're having trouble breathing, but you're not congested. Yes, I'm having trouble breathing. I'm like, I'm a real estate broker, but those are signs of a freaking heart attack. But okay, thank you for sharing. But anyway, that was a problem. Anyway, so last, I'm gonna close with this because when I had a heart attack, I was on vacation, okay, and I was by myself. But this can happen anywhere because it can happen in the middle of the night, and you're not gonna only rely on these, but this will help you. Have an Apple Watch. I believe it's the Apple Watch that is 8 or down, like 876, an older model, because that has more, it has the ECG ability to send it from your phone to the doctor. There's also blood oxygen on there. There's different apps that are on that one versus the very new ones. That's what I've been told. But anyway, look it
There's
up.
an AFib, there's just one that has the AFib model. One of my patients that rang, she called
It might be on the new one.
So a lot of them have it. I think Fitbit actually has one now also. But both of those have the indications.
So that was a really good thing because I was able to look at my heart rate and see that it was like going through the roof. And so sometimes you're like, I don't know how hard my heart is racing, but to be able to look at it and to be able to know your standing heart rate typically is important. The second thing is that sometimes those oxygen finger monitors, even if you just wanted to carry those, if you can see kind of what your heart rate is or what your oxygen level is. And if you're flying, because I have a tendency to clot and whatever, I always will take a baby aspirin. I take it anyway. But baby aspirin, if you are all of a sudden having heart pain, chest pain, you should
Do an aspirin.
chew one whole aspirin or two
Yeah.
baby aspirin? One aspirin,
Yeah.
it's the same thing, right?
Well, one is a 325 milligram, that's what you wanna chew. If you
A
have
baby aspirin is 80.
81 is a
81,
baby,
yeah.
Okay, so you wanna have one whole aspirin,
Yeah.
which is 300 and something, okay?
and you, or 4 baby,
For babies.
4 babies.
4
One-
babies,
one-
okay.
one mom.
So if you can carry them with you, the little bear, little pats, have them with you. It's something that you can do, that if you feel something, it's not gonna hurt you, but it will thin your blood, and it can potentially help you.
And call 911.
I was gonna
Right.
say, we were
Well,
talking about
yeah.
walking into the emergency room a
You're gonna
lot.
call
Call
911.
911, call 911, definitely, call 911,
Right, right.
definitely. Don't get in the car and drive yourself.
Oh, no.
Don't,
Oh, no.
right, call 911.
Unfortunately, I can't really take questions because, well, let's do this. I can have 3 questions. If there's anybody that has to go, just get up and go now, because I know sometimes
presents
people.
for questions though, too, I brought presents for questions.
Oh, you
But I
do?
can just
Okay.
give out presents.
Okay, we have,
I mean,
all right, we have 5 minutes for questions, just because we have a lot of people also in the back that have to go.
Red
Okay.
light sauna,
Okay.
red light sauna.
Oh, sauna. Yes,
Red light
sauna. There's been research about,
So
briefly.
we talk about the health of the arteries and vasodilatation, and red light sauna is one of the things that can help with vasodilatation. It really is not the thing that is going to have the greatest impact. It is an additive and add-on, right? That's my take.
Okay, quick, go ahead. I'm sorry?
Red yeast rice is a supplement. It's made very, very similarly to a statin. It's not as potent as a statin. For some people early on, it could be a good way of getting the statin down before disease develops. I would never suggest it if there's, for example, soft plaque in the artery. That's not going to be a treatment, but it is a supplement that can be taken early if there's no disease.
Jane, stand up.
I'd like to ask your opinion of metformin, because I've been turning my doctors on to it, and they're slowly agreeing that they've seen really good results in patients for lowering sugar, helps to lose weight. It's a very old prescription. It's not, it's a pill.
Can you repeat that, because I
So
didn't hear you.
metformin, the question is about metformin. It's an old medication that has decreased sugar and helped with weight loss. It was originally on label for use as a diabetes medication or for metabolic syndrome. It actually became in favor as a longevity medication at one point. This was pre-GLP-1, where the United States was injecting themselves. So it's a great drug, and it has indications for also weight loss and for elevated sugars. Anti-inflammatory also. I really like the medication.
Cool.
Longevity, though, I just chose.
Yeah.
Sorry, I'm so sorry. Go ahead.
My name is Robin. The
Troponin.
if someone has that test, should they also have the D-dimer to see if there is a clot that?
It depends on your symptoms and how you're entering the emergency room and what is actually bothering you. It's very important that you talk about all your symptoms to your doctor. D-dimer looks for clotting. It's a different kind of clotting. The troponin is actually looking for muscle damage of the heart. So you don't want one without the other, and sometimes you don't need both. A pulmonary embolism, for example, a D-dimer would be elevated, but a troponin will or will not be. So it's a little bit of a clinical decision. The point is it's less about telling the doctor what to do and more about reporting it in the right way so the right tests are done.
Could an embolism or could it mimic a heart attack at all?
Yes.
In terms of symptoms?
Yes, but
Yeah,
my
that's what I
point
thought I
is,
was
my
having.
point is that's very important, is that you've got to tell all your symptoms. Just tell it like it is. And if the troponins are negative, and you're telling them that you're really short of breath, and they'll get a D-dimer. This is their job. Yes, for sure. But they're a little different. They can go together, but it's a little clinical, subtle difference about when it would be an option.
Okay, we have two more. One there and one there, and that's it. Sorry.
They run an EKG and they say you're fine.
Oh, yeah, right. Yeah, no, my EKG was fine too. And they said, it's not your heart, packed their stuff up and was headed out the door. That's not an indication.
I'm having chest pain. Can you please write that down so my lawyer can see that that was my complaint? I'm glad my EKG was fine. That's not.
Right, it's not, right, exactly. Okay, sorry, last one.
How bad is alcohol?
Not
Okay,
good.
So
Not good.
Not good.
the French paradox really looked at alcohol early on, and in fact, in the American Heart Association, we talked about the benefits of alcohol because of things like resveratrol. And resveratrol is an amazing substance. It dilates the arteries. It's super powerful. But resveratrol is on the lining of grapes. It's in the wine. You know, who knows how they came up with that study. But reality is that as we age, the liver does not detox wine the same way. And alcohol is actually really toxic for the heart. It's associated with atrial fibrillation. So wine in moderation. If you don't drink, don't start. If you do, this is what I find interesting. The American Heart Association defines a glass as 6 ounces.
Yeah.
And when you go to a restaurant, that glass is like half a bottle. So you really have to think about what it is you're consuming. But it's really a 6-ounce glass of wine and a 4-ounce glass of hard liquor. And it's one. It's one. And, you know, less is always more.
Not supposed to have a lot
But
of
it's that one glass a day of the 6 ounces.
That's probably.
And Ozempic and that stuff, is it good or bad?
What's that?
Ozempic and all the GLP stuff?
Ozempic is fascinating because it's getting, you know, it came on the market for a specific reason and then it became a weight loss drug. This gets very complicated.
We can't, we gotta stop.
It's a good one.
Okay, Twilight, we gotta stop, love you, but we can't. Okay, I'm just gonna say one thing, please, if you do not believe that women are not taken seriously, if you do not believe that we don't need more research, if you do not believe that we do not need to be advocating for ourselves, then do not join the Circle of Red. But if you do believe that all of these things are really important, then really consider coming on the 24th. You will have to commit to $5,000 or more. So if that's not in your, in your ability to do that, I completely understand. But if you do want to do it, we need you to sign up by Thursday because the names need to be in to the security at JP Morgan's offices. Okay,
Quickly, yes.
very quickly. So please, join the Circle of Red. And I want to thank these two fantastic ladies.
The stint that we were talking about, we did that, we funded that. Stints, we were funded, the Heart Association funded research that actually ultimately funded stints. We did that through the generosity of donors like you who support the organization so we can continue to move forward, to set the guidelines to assure that doctors like her are keeping us healthy.